Hey guys, so today I'm going to talk to you a little bit about a kit I made. It's a kit for physical dysfunction, and you might be wondering, what is physical dysfunction? Well, physical dysfunction is an impaired or abnormal functioning. So how does that relate to occupational therapy? Well, in occupational therapy, we help people get back to their normal functioning. That's the main goal. We help them to function in life as independently as possible. So some of the areas where we might see some physical dysfunction are things like arthritis, burns, cardio issues with their heart, CVAs, spinal cord injuries, TBIs, respiratory issues, hand injuries, issues with fractures, broken bones, things like that. And that's where your occupational therapist will come in and actually help you to learn to function while coping with these conditions. So today we're going to go through my kit and I'm going to tell you what's inside of it and how it can really help you become the best occupational therapist or occupational therapist assistant that you can be. Okay, so one of the first items I want to show you in my kit are playing cards. And playing cards, while they seem really simple and really basic, are actually a great way to work on a large set of skills. You can use them by playing games such as solitaire, go fish, 52 card pickup, spades, spider, hearts, rummy, and numerous other games. You can also play them on the ground, having your client work on range of motion, and track stability, or laying on their stomach. So a lot of things that can be addressed, some skills that can be addressed with playing cards are things like fine motor skills, social interaction, upper extremity range of motion, hand-eye coordination, sequencing, motor planning, memory, math calculation, bilateral integration, working and crossing midline, lumbrical grasp, dynamic and static trunk stability, color, shape, number recognition, and problem solving. So a whole lot can be done with that one little item. The next portion is we have these 3 books. And these 3 books I kind of group together because they do address similar skill sets. Each of these can be used to work on hand or grip strength as well as mental strength in regards to recognition, visual motor, and problem solving. So the therapist can instruct the client on how to use these. The task can be done laying on their stomach or on a therapy mat, again, to work on building those trunk muscles. So the first one we have is hidden pictures. And this really does address figure ground perception. You have geometric coloring, which again, deals with figure ground as well as shapes and hand strength. And then you also have, for people who have a deficit and have low vision, this large print word search is actually really great for them because the print is large and it makes it a little bit easier for them to see, so it's grading it down a bit. So the skills addressed in these books would be things like figure ground perception, color, letter, shape recognition, fine motor skills, grasp, hand-eye coordination, sequencing, bilateral coordination, working and crossing midline, static dynamic trunk support, following directions, endurance using your hand muscles, and things like that. The next item I have is something that I made called a geo board. Now this geo board is really cool. I think it addresses a great number of areas and skills. If you can see here, I use the rubber bands to make the letter A. You can also make shapes out of them. And these rubber bands are different strengths. So we have large rubber bands and also small rubber bands, so you can grade your activity accordingly. Also, if you have a client who has mastered, doing the letters and the shapes and really wants to work on problem solving, you'll see down here I stacked a bunch of rubber bands on top of each other. And what the therapist would do is present this to the client. You can do it all over the whole board and have them try and remove the rubber bands. It really does work on problem solving and figuring out sequencing what comes next. So this does address a large number of skills, things like fine motor skills, various grips such as pad to pad, lateral, free draw chuck, endurance, sequencing, eye-hand coordination, bilateral coordination, working at and crossing midline, figure ground perception, praxis, color, shape, and letter recognition, static dynamic balance, auditory simulation. You can actually strum these and have them create noise in different lengths, create different sounds, memory, and problem solving. The other thing you can do is you can actually take different things with grips such as a clothespin and have them do it with that. That is a way to grade it up and make it a little bit more difficult and have them work more precisely on that pinching grip. The next thing I want to show you in my kit is something called Color Match. And what this is it's basically working on your cognitive ability, deciphering colors, as well as your pinch strength. And it's a board like this. And what you do is you have just the board empty, and then you have the client take from a little container these clothespins with the matching colors, corresponding colors, and they match them up. Some of these, because it's a gradient, can be a little tricky, but if they've already mastered lining up here, we have additionally to grade it up and make it a little bit more difficult are these cards, and they correspond with the clothespins as well. You can lay these out in an order and have the patient actually follow and do each one, or you can place them around the room, have them find them. It really depends on what you're trying to address, but again, this really does work on a number of skills, not just your pinch strength, but also your cognitive strength as well. It addresses things like memory, color recognition, pinch strength, sequencing, hand-eye coordination, following directions, static and dynamic balance, range of motion, praxis, bilateral coordination, and working and crossing the midline. So let's go on to the next portion. The next item in my kit is a puzzle. Now there are many sizes, shapes, and variations of puzzles, but included in this kit is a 60-piece puzzle of the United States. Now this puzzle can be put together normally, or it can be graded up or down depending on the capability of your client. So it can be graded up by, once the puzzle is complete, having them answer questions about color, word recognition, location, and directional recognition. It can be graded down by completing part of it first and then having the client finish the rest, or by outlining the puzzle and having the client fit the pieces based on that. Some skills addressed with this are praxis, pinch, fine motor, and hand manipulation, hand-eye coordination, sequencing, visual motor skills, following directions, problem solving, shape, color, word recognition. You can also work on upper extremity and reach if you place it on the floor and have the client at the edge of a mat or lying on their stomach, trunk support, static, and dynamic. The next item is called the Go Together game. And this is basically just a bunch of cards, and what you do is you match them up. For example, hammer goes with a nail, and soap goes with a bathtub. And it basically just helps with recognition and what things go together. You can lie them on the floor, you can play a game of memory with them, or it's just good for association with some clients. Skills addressed in this activity would be memory, shape recognition, pad-to-pad grasp, hand-eye coordination, problem solving, bilateral coordination, working at and crossing midline, and following directions. The next activity I have is a bag of games. And there's chess, checkers, and Chinese checkers inside here. And this, checkers is a real basic game as far as, moving pieces, and it's not too hard, but chess actually is graded up because it requires knowing what pieces move where and what they can and cannot do. So a way that you can, use those two games, one easier and one harder, grading up or down. There's also Chinese checkers in here. You can, additionally, to grade it up, use pinchers, either tongs or some sort of a pinching utensil, and have them move items that way. To work on range of motion, you could Velcro the board onto the wall and have all the pieces have Velcro on them, and that's how you play, by doing it on the board. Really work on range of motion as well as mobility and stability of your client. They can be standing, they can be seated. Skills addressed with this particular activity include grasp, sequencing, praxis, memory, following directions, hand-eye coordination, bilateral coordination, working at and crossing midline, problem solving, color recognition, upper extremity range of motion, isolation of the fingers, static dynamic trunk support, and figure ground perception. The next activity I have is a simple needle point kit. And this basically comes with a plastic needle that you thread colored yarn through. And then you take that and you thread it through this pre-printed pattern on the canvas. This task can be graded down by having part of the canvas already completed and the patient finish the rest. It can be graded up by using thinner material or having a canvas that is not already pre-printed. And this really works with a lot of figure ground perception as well. And if a client is having a hard time initiating a task, again, you can use hand over hand or tactile cues to kind of get them started or restarted if they come to a stopping point. Skills addressed in this kit include fine motor skills, grip and grasp, endurance, hand-eye coordination, in-hand manipulation, bilateral coordination, figure ground perception, texture stimulation, sequencing, praxis, and following directions. You can also work on problem solving. The next item in my kit is a necklace and bracelet kit, and it comes with various types of cord. So you have thinner cord, thicker cord, some that's a little bit softer, some that's a little bit harder, and it comes with beads. There are these small beads, there's beads with letters on them, and there's also larger beads. So this activity can be graded up or down based on the dexterity and the ability to pinch and grab items that your client possesses. So it can be, graded accordingly based on the type of beads and the type of cord you choose to use. You can also make patterns out of it, so it really does address things like fine motor skills, grip and grasp, endurance, hand-eye coordination, in-hand manipulation, bilateral coordination, color, letter, and shape recognition, figure ground perception, sequencing, praxis, following directions, and problem solving. Next item in my kit is Play-Doh and clay. Now, Play-Doh and clay can be used to build hand strength and work on in-hand manipulation. Also, you can take beads and smaller items, such as coins or beans, and hide them in the Play-Doh, work them inside the Play-Doh or the clay, and have the client kind of find them, look through it, use their fingers, and find the items and pull them out. You can also take portions of the clay or the Play-Doh and have the patient snip it off with their fingers, pinch it off, and then make a pinch pot or roll it into a ball and make a little container full of those, which work on a lot of skills that way. The Play-Doh does provide less resistance, a little bit softer texture, whereas the clay does make it a little bit harder, so you can kind of grade it depending on what your client is capable of. Some skills addressed with this are color, shape recognition, fine motor skills, grasping, pinching, hand-eye coordination, sequencing, bilateral coordination, working out and crossing midline, static and dynamic, balance and support, so you could actually have them on a mat doing this, following directions, endurance of your hand muscles, as well as some praxis. The next item in my kit is a beach ball and bubbles. Beach balls and bubbles are two very simple things, but they can address a lot of areas. You could either have your client sitting on the edge of a mat, a chair, on the floor, and you can toss the beach ball back and forth. You can blow bubbles. You can have them do it with one hand, so they only are using one hand. You can have a client pop bubbles with their fingers, so they're only using one hand, finger isolation. It really does work on range of motion and things like that. So it does address things such as gross motor skills, static and dynamic trunk stability, upper extremity range of motion, praxis, hand-eye coordination, bilateral coordination, finger isolation, fine motor skills, including your mouth to blow the bubbles, as well as your hands, endurance, reach, and following directions. The next item on my kit is a diagnosis bag. And this is a dark bag that I filled with numerous tiny items. And what you would do is you would keep it closed, and it actually tightens around the client's hand. So they would feel inside here to try and determine what they're feeling. So you have little things like a seashell, you have a dice, you have nails, you have a key, there's buttons, coins, clips, and also a big round circle. So there's a variation of things that are inside here. It is, if it's too much for your client to feel inside the bag, you can also dump the items on a table and take a piece of paper or a folder and have them reach behind to allow more room to maneuver the items. You can also throw all these items on the floor, and to practice reaching skills, you can have them use a reacher to pick them up. So this does address things like diagnosis, fine motor skills, memory, various grasps and pinches, and tactile stimulation. The next item on my kit is something I like to call a grab bag. And inside this little bag, we have a pair of tongs or oversized tweezers. We also have a clothespin, and we have Mr. Pac-Man, who if you squeeze this way, he can pick things up. So this works on various things. It works on a lot of pinching with just your two fingers with this. You can call in more hand muscles if you use the tongs. And then if your patient really has an issue with precise hand movements, they can actually use their entire hand and open up Mr. Pac-Man this way. So they can use their entire hand instead of just their fingers. But you can use it to work on picking things up, such as pom-pom balls, or we have beans, and we also have coins in this bag right here. Also, we have this one container has a slit in the top, so it's almost a coin bank, so you can push the pennies through it, which provide a lot of resistance because it's not a very big hole right here. So you do have to work them in and really can work on that endurance and that hand and finger strength. So this grab bag assesses things such as various grips and grasps, texture stimulation, hand-eye coordination, praxis, hand strength, fine motor skills, math calculation, sequencing, bilateral coordination, following directions, and problem solving. This portion of our kit is the craft bag. And inside this craft bag are various objects that can be used together or separately, depending on what you're trying to do in therapy. Some of the items included are colored pencils. You can use this to color. There's a ruler. You can use this for calculations, for measuring, different things like that. There's also duct tape and scotch tape. There's pens and pencils, and we even have one of the pencils has a gripper to help assist that tripod hold. We also have rubber bands, which are different strengths, so you can use them to strengthen the hand muscles or for other things throughout the kit. There's also paper clips, which you can use actually to make an adaptive button loop, or you can string them together to make jewelry, or a number of other things throughout the kit. There's also these scissors, which are known as assisted scissors, because they have a spring right here that helps with pulling back up the scissors and can really help if you have a client that's really struggling with that. There's also pipe cleaners. These can be used to string beads, they can be used to make animals, various things you can do with that. Also, they can evoke some sort of stimulation through texture. There's also straws, so you could actually take a pom-pom ball from the grab bag and the straw and play straw soccer by blowing the pom-pom ball, or you can have it like an obstacle course, really strengthening those mouth muscles. We also have two large dice, oversized dice, and you can roll these. You can have the client do mathematical calculations. You can roll one and say, well, we're going to do so many of these exercises. It landed on a 5. Let's do 5 of these exercises or 5 of these activities. There's also this greeting card kit that can help with correspondence and social interaction. You basically make your own card, and you could have them work on writing a letter to somebody. So the skills that are addressed throughout the craft bag portion of the kit are fine motor skills, various grips and pinches and grasps, endurance, praxis, hand-eye coordination, figure-ground perception, social skills again with that straw soccer or the greeting cards, memory, sequencing, bilateral coordination, working at and crossing midline, mathematical calculations, upper extremity range of motion, number, color, and letter recognition. Now the next portion of my kit is we have some TheraBand and we have a stress cow. So the stress cow can be used as a calming tool, or it can be used to improve hand strength. It can be tossed back and forth to work on range of motion and eye-hand coordination. You also have different strengths of this TheraBand. So depending on what your client needs, you can adjust it. Another thing you can do is tie it together like this and have your client work on dressing skills by having them pull it over their head or pull it over their legs to really get that motion of putting on a shirt or pulling on pants. So these things can address skills such as upper extremity range of motion, stretching, strengthening, endurance, grip, grasp, static and dynamic stability, ADL training, hand-eye coordination. The next portion of my kit addresses the ADL of self-care. Included in this portion are an oral care kit, which includes a toothbrush, a tongue scraper, a mirror, as well as a dental aid, and then some floss. It also has a nail kit, which has a scrubber. This can be for your feet. This is for clippers and then toe separator. It also contains a sewing kit, as well as a pill splitter, a hairbrush, forks and spoons, and socks. So in therapy, each of these items can be used as it was intended to increase a patient's ability to independently complete self-care activities. It's really important to note that for each client, you need to get a separate set of tools, and if you're going to keep them, to label them in their own bag to prevent infection and spreading of things like that. So the areas that would, or the skills that would be addressed in this would be fine motor skills, gross motor skills, oral motor skills, self-care skills, various grips and grasps, hand strength, endurance, upper extremity range of motion, sensory issues, sequencing praxis, bilateral coordination, static and dynamic trunk control, and working in portion of my kit is basically other supplies that you might need throughout your therapy. We have things like a gown, a hairnet, a mask, latex-free gloves, hand sanitizer, tissues, antibacterial wipes, as well as Clorox wipes, a CPR mask, a notepad, a timer, various sizes of goniometers, ranging from a large one to finger goniometers, a tape measurer, a gait belt, as well as we have counterliner and Dyson, which really help if you have patients that are slipping, and they really allow for that not to happen. So all of these items can be used during your therapy session, whether you're screening somebody or just to promote safety for not only yourself but also the patient. So the last portion of my kit is the resource notebook, and it has two major sections. The first one is physical dysfunction data, and it basically, if you can see scrolling on the screen, has a list of different things that you can use to screen the client and to also evaluate the client and help with therapy. The other section is intervention directions for the kit, and it basically just gives you ideas and ways to use the various tools and items in the kit. However, make sure you realize that you can intermix any of these items, and that really does give you a vast number of options for physical dysfunction. The other thing is, in regards to an approach for this kit, it really was a combined various different approaches that I used. It wasn't any one. There were things from biomechanical, from NDT, from PNF. It's kind of a mix of everything. So there's not any one approach that this kit addresses. The other thing last thing I want to leave you with is safety precautions. If you can see them scrolling on the screen, just really pay attention and make sure that you review this section of the kit, because it really is essential to keep not only yourself but your client safe. Thanks so much for letting me tell you about my kit.